Seeing blood in the toilet bowl after a bowel movement can be alarming. It's a sight that can cause immediate concern and anxiety. Many people might feel a rush of panic, wondering what could be wrong. The presence of blood in the stool is a symptom that should not be taken lightly, but it's also important to approach the situation with a calm and informed mindset. While it's not always a sign of a serious problem, it's important to pay attention to this symptom. Blood in the stool can be caused by a variety of conditions, some of which are benign and easily treatable, while others may require more serious medical intervention. Hemorrhoids, for instance, are a common cause of bright red blood in the stool, and are usually not a cause for major concern. However, other conditions like gastrointestinal bleeding, ulcers, or even colorectal cancer can also present with blood in the stool. Blood in the stool, medically known as hematochezia, or bright red blood, or melena, which is dark blood, can present in various ways. Hematochezia typically indicates bleeding in the lower gastrointestinal tract, such as the colon or rectum. On the other hand, melena, which appears as black tarry stool, usually suggests bleeding higher up in the digestive tract, such as the stomach or small intestine. Understanding these differences can help in identifying the potential source of the bleeding. It may appear as bright red streaks on the toilet paper or in the toilet bowl after a bowel movement. This type of bleeding is often associated with conditions like hemorrhoids or anal fissures, which are small tears in the lining of the anus. These conditions can cause discomfort and pain, but they are generally not life-threatening, and can be managed with proper treatment and lifestyle changes. Sometimes the blood might be mixed in with the stool, making it less noticeable. This can happen with conditions like diverticulosis or inflammatory bowel disease, where the bleeding is more diffuse and not as easily seen. It's important to be vigilant and to look for any changes in stool color or consistency, as these can be subtle indicators of underlying issues. In other cases, the stool itself may appear black and tarry, indicating the presence of digested blood. This type of stool, known as melena, can be a sign of bleeding in the upper gastrointestinal tract, such as from a peptic ulcer or gastritis. The dark color is due to the blood being partially digested as it moves through the intestines. Melena is a more serious symptom and warrants immediate medical attention. Remember, any sign of blood in the stool should never be ignored. Even if the bleeding seems minor or infrequent, it's essential to get it checked out by a healthcare professional. Early detection and diagnosis can make a significant difference in the outcome of many conditions. Ignoring the symptom or delaying medical consultation can lead to complications and more severe health issues down the line. It's crucial to consult with your doctor to determine the underlying cause and receive appropriate medical advice. Your doctor may recommend a series of tests, such as a colonoscopy, stool tests, or blood tests, to identify the source of the bleeding. Based on the findings, they can provide a treatment plan tailored to your specific condition. Taking prompt action and following medical advice can help manage the symptoms and address any underlying health issues effectively. The color of blood in the stool can offer valuable clues about the source of bleeding. It's important to pay attention to these signs, as they can indicate different health issues that may require specific treatments. Blood in the stool is not something to ignore, and understanding the color can help in diagnosing the problem more accurately. Bright red blood typically indicates bleeding in the lower gastrointestinal tract, such as the rectum or colon. This type of bleeding is usually fresh, meaning it hasn't traveled far through the digestive system. Conditions that can cause bright red blood include hemorrhoids, which are swollen blood vessels in the rectal area, and anal fissures, which are small tears in the lining of the anus. This type of bleeding is often associated with conditions like hemorrhoids or anal fissures. Hemorrhoids can be internal or external, and they often cause discomfort, itching, and bleeding during bowel movements. Anal fissures, on the other hand, can cause sharp pain and bleeding, especially during or after passing stool. Both conditions are common and can usually be treated with lifestyle changes, medications, or minor procedures. On the other hand, dark, tarry stools known as melena suggest bleeding higher up in the digestive tract, such as the stomach or small intestine. Melena is characterized by a black, tarry appearance and a distinct foul odor. This type of bleeding is often a sign of more serious conditions, such as peptic ulcers, gastritis, or even cancer. Melena occurs when blood is digested as it travels through the digestive system, giving the stool its characteristic black color. The process of digestion breaks down the blood, which is why it appears dark and tarry. If you notice this type of stool, it's crucial to seek medical attention promptly, as it can indicate significant internal bleeding that needs to be addressed. Understanding the difference between bright red and dark blood in the stool can help your doctor determine the potential location and cause of the bleeding. This knowledge is essential for developing an effective treatment plan. If you experience any form of blood in your stool, it's important to consult with a healthcare professional to get a proper diagnosis and appropriate care. Early detection and treatment can make a significant difference in outcomes. Several factors can lead to blood in the stool, ranging from common and easily treatable conditions to more serious medical issues. Hemorrhoids, swollen blood vessels in the rectum and anus, are one of the most common causes of rectal bleeding, often resulting in bright red blood. Anal fissures, small tears in the lining of the anus, can also cause bleeding, especially during bowel movements. Other potential culprits include diverticulosis, inflammatory bowel disease, and infections that affect the digestive system. In some cases, blood in the stool can be a sign of more serious conditions, such as colon polyps, colorectal cancer, or ulcers in the stomach or small intestine. Section 4, Beyond the bathroom. Recognizing accompanying symptoms. While blood in the stool is a significant symptom in itself, it's essential to pay attention to any accompanying symptoms you may be experiencing. These symptoms can often provide critical insights into what might be going on inside your body. Ignoring them could mean missing out on early diagnosis and treatment of potentially serious conditions. These additional symptoms can provide valuable clues for your doctor in diagnosing the underlying cause. When you visit your healthcare provider, make sure to mention any other symptoms you've noticed, no matter how minor they may seem. This information can help your doctor piece together the puzzle and arrive at a more accurate diagnosis. Abdominal pain, cramping, or bloating can indicate digestive issues such as irritable bowel syndrome or inflammatory bowel disease. These conditions can cause significant discomfort and may require specific treatments to manage effectively. Changes in bowel habits such as diarrhea, constipation, or a change in stool consistency can also be red flags. Diarrhea might suggest an infection or a chronic condition like Crohn's disease, while constipation could be a sign of a blockage or other issues. A change in stool consistency, whether it becomes more loose or more hard, can indicate various digestive problems. It's important to note these changes and discuss them with your doctor. Other symptoms to watch out for include unexplained weight loss, fatigue, nausea, and vomiting. Unexplained weight loss can be particularly concerning as it might indicate a more serious underlying condition such as cancer or a severe infection. Fatigue can be a sign that your body is fighting off an illness or that you're not absorbing nutrients properly. Nausea and vomiting can be symptoms of a wide range of conditions, from infections to more serious diseases. If you experience any of these symptoms along with blood in the stool, it's crucial to seek medical attention promptly. Early diagnosis and treatment can make a significant difference in outcomes, so don't hesitate to reach out to your healthcare provider if you're concerned. Section 5, When to worry. Seeking prompt medical attention. While not all instances of blood in the stool require immediate medical attention, certain situations warrant a prompt visit to your doctor. If you experience heavy rectal bleeding, especially if accompanied by dizziness, weakness, or fainting, seek emergency medical care immediately. Similarly, if you notice a significant change in bowel habits, such as persistent diarrhea or constipation lasting more than a few days, consult your doctor. Unexplained weight loss, severe abdominal pain, or persistent nausea and vomiting should also prompt a medical evaluation. Remember, early detection and treatment are crucial for optimal outcomes, especially for more serious conditions like colon cancer. Section 6, Taking Charge. Practical advice for digestive health. Maintaining good digestive health is essential for overall well-being and can help prevent issues like blood in the stool. One of the most important steps you can take is to consume a balanced, fiber-rich diet that promotes regular bowel movements and prevents constipation. Incorporate plenty of fruits, vegetables, whole grains, and legumes into your daily meals. These foods are rich in dietary fiber, which adds bulk to the stool and makes it easier to pass, reducing strain on the rectum and anus. Remember to drink plenty of water throughout the day to stay hydrated and support healthy digestion.